Welcome to the High River and District Healthcare Foundation. I'm Jody Seeley, and today we are joined by our High River Hospital. I think we call him the spiritual care guy, also the chaplain, also the whatever, but you're our dude. How are you, my friend?
Pretty good, Jody. Nice to see you. How are you today? Did you order the snow that's falling?
No, but
No,
I feel like I'm enjoying my coffee more with it falling outside the window. Feels
there
very
is that. Although it feels like we should assign blame to somebody for this.
yeah.
That 18 degrees the other day was a
Was
little
so
bit deceiving.
beautiful. Yeah, I
Nice.
know. And here we are back in the snow. But if weather does what weather does, it's supposed to be really nice again next week.
Good.
And all the kids are off for school next week for Easter break,
Yep.
so it'll be fine.
We'll take it.
Yeah. Well, we appreciate you taking a moment to come and chat with us. We know we have a kind of a full day sort of workshop, seminar, learning session, whatever you want to call it, coming up at the end of the month that we wanted to connect with you on. And it's the Road Show. And we finally get to have it after it being on hiatus with COVID also. And it's put on by the Alberta Hospice Palliative Care Association. And basically, you're going to talk about death. So, Darrin, you and I have had this conversation before. It's a topic that people don't really like to talk about, but we hope that people will grab a coffee and take a moment and talk about death with us today. So, what does that mean to you when I say that?
Well, for me, it means it's just something normal because that's what I do every day. That's what we do. And with the Alberta Hospice and Palliative Care Association, that's our expertise, our area, that's our thing. So for me personally, it's okay. We're talking about
Your
work,
everyday stuff.
something that it happens every day. Now, for the average person, though, it's something where you probably want to run the other direction, and most people do. We live in a culture and a society that is typically fairly death denying. We're uncomfortable talking about death. We are uncomfortable facing our own mortality. There's fear around that. And the way human beings, I think, tend to handle fear and discomfort is to avoid it, number one, as much as possible. And then when we can't do that, we tend to try and clean it up and clinicize it as best we can and make it very antiseptic and make it very, very, I guess, scientific or minimal as far as it impacts our entire human experience. So we try to make it as small as we can if we have to face it, and then run away as quick as we can.
Yeah.
But for those who I guess would attend the roadshow, which is what we call it, there's obviously an interest in end of life care for people. We would say right away that death is an inevitable part of life, and if that's the case, then I think it matters a lot how we talk about it, how we embrace it, how we feel about it, how we anticipate it, because death is going to happen. It happens every day for people. It happens every day for loved ones of people. And the beautiful thing about the Alberta Hospice and Palliative Care Association is we're well aware that in Alberta, there are tremendous resources and educational opportunities and people that we can bring together and have conversations about not only death, but the care that people receive as they face their death and as they approach their death. And so we bring together expertise, we bring together clinicians, practitioners, we bring together all kinds of people, healthcare professionals, volunteers, family members, even patients diagnosed with a life-limiting illness. We bring people together, they network together in the Roadshow Conference. It's a wonderful day to spend together. And the AHPCA, as we call it, spends a tremendous amount of time and resources networking Albertans to talk about this thing, because we believe, as we all should, that end-of-life care, hospice and palliative care throughout Alberta ought to be accessible to every Albertan, and it ought to be good. I think we've all heard horror stories of someone we knew, maybe a grandparent or someone who died many, many years ago, and those who are present describe it as a horrible scene. Yeah. And I think that good hospice and palliative care goes a tremendous distance in changing that, making death less bumpy, if I can borrow a street word. And there are lots of things that we do around death and dying to to support patients, to give them a death that is something that they deserve, that's peaceful, comfortable, as much as we can, and providing support for the family members, because it's an experience that they will never forget. They will mark as a boundary point or a threshold in life where they will divide life almost into two chapters. There was before, there was then, and then there's now. And the death is the thing that happened to change all of that. So we don't run from death in the Alberta Hospice and Palliative Care Association. We run to it.
Yeah.
And those healthcare professionals involved in end-of-life care, I guess we're the fools. The old saying that fools rush in where angels fear to go.
Yeah.
We are those fools that will rush in to be present with those and to those who are going through the death and dying experience. And that's what we talk about at the Roadshow.
So it's open to anybody to attend. Does it focus, like, is it geared for more if you are in the position where that's going to be a reality for you, for a loved one or yourself, and you want to learn more? Could you come if you're nowhere near that stage of life, but you want to learn more and prepare yourself? Like, who should come?
You just described it perfectly. Everybody who has an interest in this, obviously practitioners, people working in end-of-life care in any healthcare setting, be that a hospital in acute care or long-term care center. Death is a reality of the people that we serve. And so anybody that working in the field obviously would be interested in attending a roadshow. In addition to that, there are a lot of people, and we rely on volunteers a tremendous amount. So there's lots of people in our communities across Alberta that volunteer and want to get involved, if they aren't already, with how to support patients and their families and the staff during the end-of-life period of time that somebody gets care. Family members, people who have lost somebody, are a tremendous resource and benefit significantly from attending a roadshow because they've been through the death experience. And they're often people who can be remarkably insightful at giving support and insight to others that are either facing it or working in it. And we share those stories. We network people together. There's a wonderful lunch provided. I happen to think the two presenters are awesome, but that's a little self.
Maybe you're slightly biased. No,
slightly biased for sure.
No.
So everybody who has an interest in seeing that, because we're all going to face our own death one day, and we're all going to, maybe even more painfully, face the death of somebody we love dearly. And we are those fools that will rush right in to talk about that and to talk about ways in which we can prepare, not maybe prepare so much as be aware that life holds our mortality in front of us. Sometimes we try and push it away, but it comes back. And we want to talk about ways in which people can find that instead of making death this great villain that it has been, and it is an enemy, it is something that will have the final say. We can't change that. I wish we could. I like to sometimes say to patients, we're working on a magic wand in the shop out back, but we're nowhere near ready. Wish we could change it, but we can't. So therefore, what can we do? If death is going to have the last say, then what control do we have leading up to it? In other words, can we have a tremendous amount of input and conversation and awareness around facing death, our own or the death of somebody we love? And how can we put true living into that experience of dying? That's what we talk about a lot. So there's an emotional or spiritual disposition that we want to cultivate for people that are facing mortality and those who are working and supporting people facing their own mortality. That means we're not horrified or embarrassed. Oftentimes the healthcare system is embarrassed by death for obvious reasons. The healthcare system is there to intervene, to save life, to promote life, to create well-being, to intervene when there are problems. So because we're very good at that, what do we do then when there's nothing that can be done? Do we kind of walk away and hide, or are we sort of embarrassed by that? Or do we switch gears a little bit and alter our own way of being with people who are dying that can put a bit of hope, a bit of beauty, a bit of support, a bit of love, including a lot of laughter as well as tears, into the dying experience? So when we come together with the AHPCA to talk about death and dying, we try to take the villainy out of it as much as we can. In other words, it might have the last say, but darn it, along the way, we're going to have a say as well. We're going to whisper death into submission to some degree so that we can truly live, whether it's for the last days, weeks, or months of the death experience that a family is going through with somebody that they love. So we're going to face it head on. And this is something that the Alberta Hospice and Palliative Care Association has been doing for about 12 years. Now, the pandemic changed things a little bit. We couldn't do this. So there were creative ways in which they did some virtual workshops and ways to still educate Albertans around death and dying. But here we are, it's 2022, and we're back. We're able to get together face-to-face, network together, share some laughter, some good stimulating conversation, some education, and face death, that great villain, head on. And I hope, as we do this throughout many locations in Alberta this year, we can continue the growth of education around end-of-life care and what it means to face death as a natural part of life. So that's really what we're up to.
I love that. So it's coming up on Wednesday, April 27th. It's a
2
full
weeks
day
from today.
thing, and
Yeah.
we've got the website up here. And this is where we need people to register in advance because there's lunch provided. So we need to know how much lunch to get.
Yep. We want to feed you. We want to feed you well. We want to provide enough coffee.
Yeah,
And,
that's
we
important.
want to
You can't talk about death without coffee.
No,
Not even a little bit.
death and coffee go together very well.
But hopefully you won't be talking about taxes. The other
No, we'll
certainty
leave
of
that
life.
one out.
Is that what they say?
We'll leave
So
that
is there
one.
a cost for people to take part in this workshop, Darrin, or do they just need to register?
Yeah, you can go on to the Alberta Hospice and Palliative Care Association's website. You've got it on the screen, albertaroadshow.ca, real easy, www.albertaroadshow.ca, and it'll walk you through registration. You can join the AHPCA that further the efforts of palliative education across Alberta. $55 per year membership to join the organization, and that gives half price for the roadshow. So it'll walk you through registration right online, and it's very easy to do, and you'll get a sense of what the AHPCA does throughout Alberta, in addition to the roadshow, and lots of different topics that we've covered in the last 12 years in communities across the province. Children's grief was one of the topics. We handle complicated grief, complex grief, all kinds of topics around death and dying to support people facing that as well as families. So go on the website, have a look, and hopefully we'll see you on 2 weeks from today at the wonderful Memorial Center, Highwood Memorial Center in High River.
Sounds good. Now, are you somebody, Darrin, did you always have this great understanding, outlook, acceptance of death, or is that something you've come into over the years?
I've come into it over the years. I think as I look back in life, my career, for many years, I was a prison chaplain. And that environment deals with a lot of grief, a lot of tragedy, a lot of violence, a lot of disappointment. So grief and death was something that I was familiar with from the people I served in the correctional system for many, many years. But where it really came significant for me was when I worked with Hospice Calgary, Rosedale Hospice in Calgary, one of the best hospices in the country as far as education, end-of-life care, grief counseling and support, grief with children. And it's really there in a very, very tightly integrated team of physicians, nursing care, myself, the whole team, how we would wrap our care around an entire family in the dying process. We were an end-of-life cancer hospice, and that's what we did every day. And so a lot of the I guess, ease with which I'm able to talk about death comes from doing that, comes from working with death and dying every day and sitting at the bedside every day. And I still do that here in the hospital in High River. When you're present to death and dying, you cannot not be affected. Mm-hmm. And I think if we do that and then we reflect on that experience, we can learn a tremendous amount. The dying teach us things that are almost impossible to find anywhere else. You could go to university for 7 years and not learn what the dying will teach you. So what we do in the AHPC is we share that knowledge. The dying are gone. They can't, walk us through a PowerPoint presentation, but their story lives on in those of us who cared for them and in the family members who are with them. And so I love to say that palliative care is really storytelling, and that's it in a nutshell. And if it's a good story, if we do the story well, then the family can say our loved one was cared for very well, whether it's in a hospice, in a long-term care center, in a hospital, or at home. We want to give people a death that they deserve, that has some peace, symptom management, and we want to bring the team around that family to provide that support because we've walked there already many times. So it's really in getting involved with end of life that I would say myself, as well as colleagues of mine, grew to the point where we're at ease in talking about it. Somebody joked around, we're the last people you want to see.
And the last people they will, maybe.
Yeah. Sometimes the last they will, right? But if you happen to need somebody for end of life care, then we're the ones you want to see.
Yeah.
Because we know how to hold the space, I guess, and we learn every day from the dying. Every story of a death that I've sat with and through tells me something, including the death of my own dad almost 1 year ago exactly. Yeah. And I'll share the story a little bit about that because there's some heartbreak and some tragedy and some beauty and there's colorful messiness around it. It's all there in my own dad's death. And I draw from that. And then from the patients who I've been with over the last 7 years, and how to educate others around what they teach us in those last days to weeks or a few short months. So it would be the latter. I may have had a youthful, foolish sense of male invincibility when I was young. Invincible around
I think that's normal. Yeah.
That's normal for men in our society. Maybe it's normal for everybody, but I certainly know it's true for men. We believe we were invincible. So I probably had a sense of an invincibility about it and lack of fear. But then as you start to grow older, you realize, holy smokes, does time ever go fast? It was like yesterday that we finished high school.
Yeah.
And had kids. And now here we are, at the stage of life, and we've buried our grandparents, in some cases our parents.
Yeah.
And that time has gone by quickly. Holy smokes, the brevity of life is astonishingly haunting.
Yeah.
So we need to do something about that, or we may not truly live during the time that we have. And that's really what palliative and hospice care is about, is learning from the dying and teaching ourselves and others to be students of the dying and to tackle this thing called death in a way that puts it into submission as much as it can. It might have the last say, but along the way, we're going to do the same. And that's what we want to talk about.
Well, let's have the last words be sweet instead of bitter. Yeah.
Absolutely.
I love that. Okay. Well, thank you for chatting with that about us today. Again, albertaroadshow.ca. We also have the links up for this on our social media if you want to click and link through and join the show on Wednesday, April 27th. Darrin, thank you for chatting with us today.
You're very welcome, Jody. Thank you for having me.
And do keep in mind, I think another thing that I just want to quickly add too is every year when we do the our Points of Light campaign, this is where a lot of that funding comes into, is our spiritual and palliative care at the hospital and within our communities. And so it's just an opportunity to learn more coming to this event. And if you're like, okay, I can't make it on the 27th, we'd still love you to visit our website and give support to that program within our community so that we can continue to support those going through palliative care within our own community also.
That's right. And I should also add, Jody, coming from a wonderful hospice as I did, I can say confidently, we do excellent palliative end-of-life care here in this hospital. And of course, in Foothills Country Hospice in Okotoks as well. So there are tremendous resources in our community. And I should also add, if anybody cannot absolutely make it on the 27th to be with us, there are other locations coming up in Alberta, maybe a little farther. Cochrane is one of them. But do check out the website at AHPCA, albertaroadshow.ca, and they will let you know what other locations if you can't be with us in High River.
All right. Awesome. All right, Darrin. Thank you
Thanks,
so
buddy.
much.
You're
Have
welcome.
an amazing day.
You as well.